Good afternoon, everybody, and welcome to this webinar looking at the place and wellbeing outcomes, and in particular at the theme around movement. My name is Irene Buteman, and I am the Place and Wellbeing Partnership Lead between both the Improvement Service and Public Health Scotland, and I've also led up on the Shaping Places for Wellbeing programme, which has made a lot of use of the place and wellbeing outcomes. I'm just going to share my screen as folks are joining the call and just set out a little bit of what it is that we're going to cover today. So, as I say, we'll be looking at the movement theme of the place and wellbeing outcomes today. But what we'll begin with is I'll set a little bit of context about place and where it sits and where the place and wellbeing outcomes sit within place, and also a little bit of background to the outcomes themselves. Then we'll get into the meat of today's webinar, which is looking at that movement briefing with Anna Gale from Public Health Scotland. And then we'll move on, and my colleague Mary Sinclair from the Shaping Places for Wellbeing programme will cover the work that we have done around place and wellbeing outcome briefings. So, to get going for today then, around that context for place, what I'd like to cover is just very quickly a little bit about place-based approaches. The work of the Shaping Places for Wellbeing programme has established a way of dealing with place-based approaches that I think it would be helpful to give that context for the work that Anna has done, and a little bit more, as I say, about those place and wellbeing outcomes themselves and where they have stemmed from and how they're being used as well. So, in looking at place itself, what we have found, and certainly in our own work around it, is that the terminology around place is varied and the understanding of it is equally varied. And we have many times where we hear of plans and strategies saying that they're taking a place-based approach, where having completed all of the, or just about completed all of the local support that we've been given in the Shaping Places for Wellbeing programme, we are now on a conclusion of what really needs to happen to fully take a place-based approach in Scotland. So what the three key elements are that we have found to taking any place-based approach is here. It needs to look at having an understanding of the people in a place and what they are experiencing, not just their health and well-being, but also what they're experiencing in respect of finances, they're taking part fully in life and so on. So we need to know about what's happening to people. We also need to know that place and what the features are in a place, and are they having a positive impact on the people who live, work and relax in that place. And then with that understanding, if we don't bring that understanding into the decision that we're making, then we're missing an opportunity to positively impact on both the place itself and then ultimately on those people who live, work and play there. So for ourselves, a place-based approach, and I think there's a need for a more common language across Scotland around what a place-based approach is to have all three of these elements in any bit of place-based approach work. Other than that, we can be in and we can be working perhaps in one of those areas, but we're not going to know exactly what is happening and be taking a full place-based approach. And an example would be, very topical at the moment, putting in a segregated bike lane into towns. If we simply go in and make the decision to put in segregated bike lanes, and we make that choice by where there's a nice wide road and we go, that isn't taking a place-based approach to doing that bit of place work. What we need to do to take a place-based approach is to understand the people in the town. Who in that town is living in a deprived area where only half of the households even have access to a car? That would start to influence where we would be deciding to put that segregated cycle lane. What else is happening in that place? We don't just want to improve active travel. We want to make sure that that active travel is there to help people to get access to education, access to work, access to support and services and community facilities. So we also need to have an understanding of that place. So Place work can certainly happen, but if it hasn't looked at all three of these key elements, then it isn't taking a place-based approach. So where the place and wellbeing outcomes, sit within that is absolutely central. They sit in that they tell us that the features that have a positive impact on the people using a place. The links there to the place standard are strong. It's the same set of evidence that sit behind the place and wellbeing outcomes as shaped the question in the questions in the place standard tool. But the place standard tool feeds into that important aspect about understanding people and what's happening to them. We have data on people, factual data, and then we have that important, rich, qualitative data about what people are saying they need from their place. And the place standard tool sits within that arena of a place-based approach and is a very good means of understanding that better. And then finally, that third element around decisions, certainly for the Shaping Places for Wellbeing programme, we've looked to do that using place and wellbeing assessments, half-day sessions that enable people to consider their plans, proposals, strategies, frameworks, and look at how is it impacting on those people and what that we've found out about them, and how is it impacting on that place as well. So as I say, central to a place-based approach is these place and wellbeing outcomes. And what's important, I think, to point out and highlight about the outcomes is that they didn't come about as a result of, a few workshop sessions with experts who decided these are the consistent things that we need to consider as important in a place. They're based on evidence, and that's what Anna's paper is highlighting and bringing to life for us, and we'll come on to hear more about that. So they are the evidence features that every place needs, but they also don't simply enable the well-being, health and well-being of people. When taken in the round with an understanding of people, they can also reduce inequalities in Scotland, and they also contribute to net zero emissions and sustainability. So they're the core of delivering on that triple win, because we do not have that luxury of time to deal with one of these issues at a time. The evidence is crucial. What it does, and this is a slide taken from a Town and Country Planning Association document about planning and health, is they look at the different themes and they look at how they track across on people's behaviour. Taking an intervention has an impact on people's behaviour, and then evidence and research shows us how that impacts on health, how it impacts on the health of our planet as well. Where they came from was as a result of this group, the Place and Wellbeing Collaborative, and there's more about this collaborative on the Improvement Service website. So this group came together in 2019 on the background of having a new planning act that introduced new requirements for the national planning framework in Scotland to, for the first time, be delivering outcomes around health and wellbeing, equality and climate change, amongst others. So there was a new ask of planning, and at the same time there was a full review being undertaken about public health in Scotland that likewise identified the importance of place. So these organisations realised that we were all working to a shared ambition to improve the places where we live, work and relax in. And we came together to see what more we could do collaboratively to move that journey forward. And one of the first things that we identified was a lack of a consistent set of features that had been identified for Scotland as what we wanted to get right in every place. And that's where the evidence and the research that had already been used to shape the place standard tool questions came into its own as part of shaping those place and wellbeing outcomes. This is a document that sits on the Improvement Service website, and gives a lot more of that background and the use of the place and wellbeing outcomes, as well as their detailed wording as well. So how have we been using the place and wellbeing outcomes and that evidence that sits behind them? One example at the moment is across Scotland, the National Planning Improvement Framework is being piloted, which looks at the attributes of a high-performing planning authority and looks to replace previous planning performance frameworks that were being prepared. We completely welcome this new emphasis on not just measuring the success of a planning authority by how quickly it processes applications and whether it has an up-to-date plan, but the introduction of the need to deliver quality, good quality places, because that is so much of what planning authorities are seeking to do. And a fifth attribute there is around place, and these pilots are using the place and wellbeing outcomes and the indicators that sit behind them in order to shape that that way of working and to become part of a high-performing planning authority. Another way that I'm certainly much more familiar with has been through the work of the Shaping Places for Wellbeing programme. That is our opening slide that we have been using for 3 years now, and the place and wellbeing outcomes are central. Our ambition to improve Scotland's wellbeing is absolutely anchored in getting the place and wellbeing outcomes embedded into our decision-making processes. So the work that we've been completing in 7 local towns that are highlighted there, we hand over support in 6 of those towns this month, and we move into a more national rollout of the work. And the work of the place and wellbeing outcomes and the use of those and taking that place-based approach in all 3 of those elements has been crucial. What it's enabled is not a new programme in town, but to go in and work locally with councils and health boards to deliver on the asks that they already had and to be able to take a place-based approach to doing that. Totally embedded in the recommendations of the Christie Commission around long-term preventative role of place and working in partnership and delivering on aspects such as the place principle and the social determinants of health, crossing over between the work of councils and the work of health boards and public health. And the place and wellbeing outcomes sit as the means to be able to do that. We haven't, in the work that we've been doing, forgotten about those other crucial elements to any place-based approach. We've been looking at what's happening to people and bringing that alive into decision-making in a manner that people can understand more visually, looking at quantitative factual data as well as more lived experience qualitative data as well. The third element of any place-based approach, bringing all of that into decision-making, as I said, is something that we've done using place and wellbeing assessments, half-day sessions that look at a plan, a proposal or a strategy and consider as early on in the preparation of that plan or proposal how it is having an impact on the features we need to get right in a place, so the place and wellbeing outcomes, and how it is impacting on the population groups that we know are impacted by inequality. And what could we be doing slightly differently or to improve on the impact on place and thus on wellbeing when we are going through those decision-making processes on plans and proposals and implementing them. The range of documents, therefore, that we have put through that lens of the place and wellbeing outcomes varies greatly over a lot of variety over the sort of geographic area as well as the sort of area of practitioner expertise. We've looked at, on the left-hand side there, we have the NHS Forth Valley Healthcare Strategy, so really up there at a regional level. And then in the far right, we have the Burnhill Neighbourhood Plan. So in looking at a small part of Rutherglen and the neighbourhood plan that was being prepared. And in each case, putting it through that session of considering the people and what's happening and considering the impact on the place and wellbeing outcomes as well. The other way that we've used the outcomes has been in pulling together the evidence that sits behind them more locally with what we have gleaned in those local towns about that quantitative and qualitative data. And my colleague Mary will go on and give a little bit more information on that later. So what is next for us as a Shaping Places for Wellbeing programme is national support to take that place-based approach. So obviously the place and wellbeing outcomes and the briefings that we're looking at in a moment are crucial to that support that we give. It's helping all local areas in Scotland now to take a place-based approach. The place and wellbeing outcomes are central to being able to do that, and any documents that bring alive that evidence help with informing decisions. We'll continue our journey looking also at the data that we've brought alive so others can use that, and an instance that comes to mind is through the evidence reports for local development plans, and how we scale up the lived experience of frontline practitioners and community groups as well. And finally, for us, an ask was of our own steering groups to give particular strength and support to planning authorities as well. So as I say, that ongoing support for the place and wellbeing outcomes continues with us. That support kind of sits in a sort of a triangle here. At the base level, we have all of the website resources, and I'll come on to the links to the website in a moment, that shows all of our learning, all of the guides that we've produced on how to take a place-based approach, including the use of the place and wellbeing outcomes, and including having the briefings that we'll be talking about in a moment. At the very top of that support is bespoke support to help others to take a place and wellbeing assessment, to look at their data approach for, say, their local development plan, or any other aspect of those three key elements that I've highlighted to a place-based approach. And in the middle sits a national learning cohort, bringing together local places to learn from each other and to learn from what we ourselves have learned through the Shaping Places for Wellbeing programme, and indeed to share, as we are today, about briefings that are bringing alive the evidence that sits behind the place and wellbeing outcomes. So there's a lot more information on the Improvement Service website, both about the outcomes and then also about the Shaping Places for Wellbeing programme and how much use it has made of those outcomes and how central they have been. I'm going to stop there, having given that very quick bit of context, to see if there are any questions, and then to hand over to Anna to get into the meat of today, which is looking at the briefing that has been prepared around that movement theme. So I'm just going to stop presenting, and if anybody has any questions, there is a Q&A section up on the top panel that you can pop things into. Jen, can I just check with you? Has anybody popped anything in? If not, quite happy to move straight on to Anna. And if, as people are presenting, questions come to mind, then please just pop them in there, and we'll stop after each presentation and take any questions at all.
Just one question in there, Irene from Melinda, just asking, are you noticing any common themes, challenges, change opportunities in council development plans?
The common challenges that we've identified through the place and wellbeing assessments came through around being the same themes, which was an ask for plans, different plans, strategies to support and align with each other. That came across a lot, so that you can't have a plan. If you think about a local development plan, it has an ambition, it's there to deliver upon the national planning framework, but it can't do it alone. It needs the support of other plans and strategies across the council and beyond. And similarly for any other plan and strategy, actually having plans supporting each other and recommendations that highlighted where that could happen, that was a consistent. And another consistent aspect that came through was around a stronger governance around place within organisations, particularly within councils, that there was that kind of governance and leadership on place to give people permission to talk to each other and to go and input into another plan and get that joining up and alignment of policies as well. Okay, if there's nothing else at the moment, then I'm going to pass over to Anna Gale, and over to you. And I'm looking forward to this. Thanks, Anna.
Thank you, Irene.
Well, good afternoon, everybody. Thank you for joining us today for this session to launch this new briefing paper, focusing on the movement theme within the place and wellbeing outcomes. And Irene's really helpfully set out the context there for us before we start. So for those of you who I haven't met before, my name is Anna Gale and I am a Health Improvement Manager at Public Health Scotland. I'm based within the Climate and Sustainable Environments team with a particular focus on the links between transport and public health. And as part of my role, I support the work of a national partnership called the Public Health and Sustainable Transport Partnership, which closely links with the wider Place and Wellbeing Collaborative, which Irene has introduced. So today what I plan to do is give an overview of the new briefing paper. I'm going to talk about what's included within the briefing paper and then how it can be used. As we go through the slides, you may have some thoughts and ideas as well about how you could use it within your own role or your own organisation, and it would be really great to hear that as we go through the discussion later on. So this is what it looks like. This is the front cover of the briefing paper here, and we will circulate a link to the briefing paper, which will be accessible via the Improvement Service website after today's session. So I'm just going to start with a bit of context about why we developed this and where this came from. So both through the Place and Wellbeing Collaborative and through the Public Health and Sustainable Transport Learning Network, we hear questions and comments like this from practitioners working across transport, across planning, health and beyond, asking similar questions and comments. So, you know, people saying, well, yeah, we know that there's lots of evidence out there, but we just don't know where to start. Or how do we demonstrate how our work is impacting on health? Or more specific questions like, you know, what is the link between public transport and health? So we really wanted to kind of explore some of that in a bit more detail. And at Public Health Scotland, we have a number of publications which often demonstrate these linkages, but are often hidden within a large document focused on a particular topic area. So, for example, road-based reallocation or transport poverty as examples. So often the fundamental linkages between transport and health and this evidence gets a little bit lost. So because of all these comments and questions, we wanted to produce a really short briefing which provides accessible, easy to understand information, linking the different modes of transport to health and health inequalities. So in discussions with Irene's team within the Improvement Service, we felt it would be really helpful to do this across all of the place and wellbeing outcomes, given the strong linkages between them all. So this briefing that we're launching today draws on existing evidence and covers the movement theme within the place and wellbeing outcomes. And it draws on evidence to set out the ways in which aspects of the transport system, so including active travel, so walking, wheeling and cycling, public transport and motorised traffic, impact on health and health inequalities. So the briefing paper is aimed at policymakers and decision makers in the transport sector, planners and managers at all levels in local authorities and health boards, other community planning partners, including health and social care partnerships, third sector organisations and community groups. So what I'm going to do now is talk through what's in the briefing paper. What I'll say is I don't think anything I say here will be new or revolutionary, as it draws on evidence that already exists. But we hope that the way that the paper has been designed will be really helpful in illustrating the linkages between transport and health, and hopefully will be helpful in your roles in terms of writing committee papers, funding applications, business cases, and so on, really to help support that decision making at a local level. So again, we're keen to hear from you as to how you think it can be used within your own roles and organisations. So I'm going to start by setting the context and the relationship between transport and place and wellbeing. So as Irene said at the start, the places where we live, work, play and age all have a really important role in determining our health and wellbeing and enabling communities to thrive. So the first part of the briefing paper sets out what's needed for a transport system which is supportive of both population and individual health. So the transport system, including active travel, public transport, private vehicles and transport infrastructure and services, is a really essential part of a place. It's integral to creating better health and does so in so many different ways. But it can also cause harm to health. So transport itself provides physical access to the building blocks of good health and well-being, such as education and employment, affordable and good quality healthy foods, leisure and the natural environment, and social and community connections. And you can see this on the slide here. And I quite like this analogy of almost like a Jenga block, that you need all these different blocks, building blocks, to enable people to have good health and well-being. And as if you take some of the pieces out of the Jenga block, it starts to crumble, and we'll start to explore some of that as we go through the slides. However, we know that motorised vehicles, particularly private motorised vehicles, can cause harm to health, including road traffic collisions, financial hardship from forced car ownership where other travel options are lacking. We see roads with high traffic levels or speeds can disrupt interaction between communities on two sides of the road, and this is often referred to as community severance. And what we see is the impact of a road between two communities, where it affects both the interpersonal networks and social contacts of the residents, but it also reduces access to goods and services for some members of the community as well. And obviously pollution from particulate matters and emissions, which are responsible for global warming and climate change. So modes of transport that minimise their impact on the environment, promote equity and contribute to improved health and well-being, referred to as sustainable transport, reduces these harms. But we know that not everyone has access to the same transport options, and transport poverty is defined as the lack of transport options that are available, reliable, affordable, accessible, or safe that allow people to meet their daily needs and achieve a reasonable quality of life. And this has really important health and social implications because it means that not everyone has equal access to these building blocks of good health. So the first section of the briefing really sets out what we need a transport system to look like to support individual and population health. The briefing then goes on to talk a little bit about the policy context, and it talks about the National Transport Strategy 2, NTS2, and how it outlines 4 interconnected priorities to deliver its vision. So reducing inequalities, taking climate action, helping to deliver inclusive economic growth, and improving health and well-being. And integral to that is about embedding the sustainable transport hierarchy, where active travel, so you can see on the diagram here, where walking, wheeling and cycling takes precedence, followed by public transport, while single occupancy car use remains at the bottom of the hierarchy. And this should be embedded in decision making to achieve these challenges outlined within the transport strategy. So one way of supporting a sustainable transport system to improve population and individual health is ensuring that the outcomes within the movement theme are met in conjunction with the other themes of the place and wellbeing outcomes. So the briefing then goes on to talk more in depth about the outcomes that sit within the movement theme. And I'm just going to read these out just now. So the first area within the movement theme is around active travel. So the outcomes are that everyone can easily move around using good quality, accessible, well-maintained and safe wheeling, segregated walking and cycling routes and access secure bike parking. And that everyone can wheel, walk and cycle through routes that connect homes, destinations and public transport, are segregated from and prioritised above motorised traffic and are part of a local green network. In terms of public transport, the outcome is that everyone has access to a sustainable, affordable, accessible, available, appropriate, safe public transport service. And in terms of traffic and parking, everyone can benefit from reducing volume of traffic and traffic speeds in the community, and that everyone can benefit from traffic management and design, where traffic and car parking do not dominate or prevent other uses of space, and car parking is prioritised for those who don't have other options. So these outcomes should be embedded in a way that takes account of the needs of different population and I can't say that word, geographies, to ensure that they achieve equitable outcomes for all. And embedded in all of this, the principles of equality, net zero emissions and sustainability underpin all these themes and should be embedded within policy and practice. So the briefings then go on to describe how each of the outcomes within the movement theme can contribute to improved health and or reduced health harms. And it also demonstrates the potential impact on health inequalities if the needs of different population groups are not considered when developing and delivering policy. So what you'll see in the briefing within each of these sections is a flow chart like this, where the place and wellbeing outcome is on the left-hand side, and it shows the evidence-informed linkages to health. And there's a bit of narrative underneath as well. So this is the flow chart which shows the linkages across active travel in terms of walking, wheeling and cycling. So we know that there's good evidence that walking, wheeling and cycling can bring benefits to both physical and mental health. And using these modes of transport for both recreation and commuting can play a really important role in increasing the level of physical activity and can provide opportunities for social interaction. In addition to the benefits directly from walking, wheeling and cycling, by being exposed to green space whilst travelling actively can also provide additional health benefits. Local inclusive economic growth can play an important part in improving health and reducing inequalities. So therefore, by improving safe walking, wheeling and cycling infrastructure, it can increase footfall for local businesses. So all of these factors together can contribute to the reduced risk of cardiovascular and respiratory diseases and improved mental health and well-being. We know that there is risk for pedestrians, wheelers and cyclists who can be at risk of injury from falls, particularly if paths and pavements are uneven or poorly maintained. However, the greatest risk for pedestrians or cyclist injury is from motor vehicles. So having safe infrastructure that separates pedestrians and cyclists from motor vehicles and safe speed limits are needed to reduce this risk. And I think it's important to say here that the health benefits of walking and cycling outweigh any potential health risks and harms. And I'll come back to the inequalities aspect further on in my slides as well. So again, this is the diagram in relation to public transport, so very similar format that you'll see throughout the briefing paper. So public transport is a sustainable mode of transport. It's essential for many people to access health and social care, other services, employment, education, training, leisure, sport and social activities. And again, it goes back to that transport system which gives us access to the building blocks of health. So using public transport often involves walking, wheeling or cycling to stops and stations and can contribute to increased levels of physical activity and improved health outcomes. It also offers an opportunity for increased social connection on the transport itself. You know, if you're at the bus stop and you have a chat with some people that are there, or maybe you get on the train and you have conversation. But it also enables people to get out and about beyond the transport itself, reducing that risk of social isolation. Public transport can carry people more efficiently than cars. So where there is greater use of public transport, which results in less car use, this can contribute to less congestion, improved air and noise quality, a reduction in greenhouse gas emissions and fewer collisions. And again, you can see that flow chart in terms of how that then impacts on reduced risk of cardiovascular and respiratory disease and improved mental health and well-being. And similarly, when we look at motor vehicle traffic, we know that this can negatively affect the health of vehicle users and more particularly the broader community in a number of different ways. So reducing traffic levels, which is what the outcome is advocating for, will bring benefits to health due to reduced air and noise pollution, reduced greenhouse gas emissions, reduced road collisions, and reduced perceived traffic danger. Car travel itself is a sedentary form of transport, so we're not walking as much as we see in other forms of transport. And environments which are dominated by motor vehicles can often feel unsafe for walking, wheeling and cycling. And this has an impact on physical activity, not just for the car user themselves and the passengers within the car, but also the wider community as well. By having less dominated roads and transport networks, this can also lead to positive health outcomes. So roads with high traffic levels or speeds can disrupt that interaction between communities on two sides of the road, which is the community severance, which I mentioned earlier on as well. Financial hardship and poverty contribute significantly to poor health. So having limited access to public and active transport options can often result in social isolation. And people experiencing transport poverty are often forced to run a car or use private hire vehicles to access employment or to meet their daily needs, despite having limited resources. And this concept of forced car ownership places additional financial hardship on low-income households. So again, this diagram in the briefing is showing the linkages between reducing motor traffic and health. But as I said at the start of my presentation, not everyone has access to the same transport options. Transport poverty is defined as the lack of transport options that are available, reliable, affordable, accessible, or safe that allow people to meet their daily needs and to achieve a reasonable quality of life. And this has really important health and social implications because it means that not everyone has equal access to the building blocks of good health. The Public Health and Sustainable Transport Partnership Group that I mentioned at the start published a briefing earlier this year on transport poverty as a public health issue. The link to this report is in the briefing paper, so there's much more detail in there around this in terms of the causes of transport poverty and how that impacts on health and health inequalities. But within the place and wellbeing briefing, what we've tried to articulate are some examples of how inequalities are associated with different modes of transport. So if we take walking, wheeling and cycling as an example, we know that women and disabled people often report that they feel unsafe walking or cycling, particularly at night or in places that are not overlooked. There's a higher prevalence of cycling amongst higher income groups, lower prevalence of cycling amongst women, older people and people from a Black and minority ethnic background, and accessibility barriers for disabled cyclists and wheelers. Inequalities in the wider community could arise if pedestrians and cycling infrastructure is unavailable or does not meet the needs of everyone, including disabled people and older people, and this could exacerbate health inequalities. We've also then gone on to detail some examples of inequalities in relation to public transport, as well as motorised transport as well. And this slide just shows some of those populations that are most affected by that. So the briefing is then summarised with some conclusions. The evidence in this briefing demonstrates that the influence of transport on health and health inequalities is complex and very wide-ranging, and we hope that the flow charts provide a helpful illustration of that and some of the examples in which we're seeing the impact on inequalities. The transport system enables people across Scotland to access the building blocks of good health, and transport policy has the potential to deliver an integrated transport system which positively influences the public's health and addresses transport poverty. The evidence shows us that some areas of the transport system, such as active travel and public transport, have a really positive impact on health, but the differences in population needs must be considered so that health inequalities are not widened. And one of the recommendations that we make in the briefing is that a place and wellbeing assessment or a scoping health impact assessment is carried out as part of the development of national or local transport policy to ensure that these needs are identified and actions are put in place to mitigate any negative effect. And again, we can help support direct you to different links with information about how to go about carrying out these assessments. Just finally, at the end of the briefing paper, there are some other sources of information which you can see there. And finally, that's my contact details there. If you're interested in joining the Public Health and Sustainable Transport Learning Network, then please get in contact. And we have dedicated pages on the Public Health Scotland website with all the publications around transport and health if you want to kind of delve into this a bit more. So I will stop talking there. I'll maybe go to Jen to see if there's any questions before moving over to Mary.
Thanks, Anna. No, oh, I was going to say no questions in the Q&A, but I see there's some in the chat, so bear with me. Brian's asking, has community transport been considered, particularly where public transport isn't meeting people's needs?
Not so much within, well, within the sustainable transport hierarchy, community transport is part of that model. So in terms of the evidence linkages between public transport, community transport, shared transport, it will have the same impact in terms of health and health inequalities. Something that we have been exploring through the learning network is just the role of community transport, particularly as Brian says, in terms of where there is the lack of public transport. And that's something in terms of the inequalities around the kind of geographical access, particularly we see in rural areas as well. So that's kind of a long-winded way of saying yes, but no. I'm happy to kind of explore with Brian as well.
Another question is from Chris Muir saying, hi, I'm interested to know why the National Strategy for Economic Transformation is absent from the list of key national policies which influence and inform place-based approaches. Surely jobs and a productive economy are key to sustainable places.
I'll come in on that one. Yes, absolutely. What I'd listed there was the national asks that are sitting there for councils and other organisations to deliver upon, and it was just literally some examples of it. I just don't have a big enough slide, really, Chris, to list them all. There are so many asks that a place-based approach can help in the delivery on, and that's what's great about taking that approach can then help different departments to work collaboratively on meeting their own different asks that they're being asked, I'm going to say asked again, that they're being asked to deliver upon. So it really just was to give some examples. I noticed also, Jen, there was another question in the chat about how the place and wellbeing outcomes have 13 outcomes, and the place standard has 14 sets of questions. It is something that's come up recently in conversation. The place and wellbeing outcomes have people right at the heart of them, and because of that, we felt that there wasn't a need for an outcome specific to people because it's all about that impact on people. However, we have been having conversations about that access to a range of opportunities for social participation and social support appropriate to people's needs. So it's something that we'll be taking back to the place and wellbeing collaborative that I referred to earlier to get their thoughts on it, if it would be helpful to add that. At this point where we've completed 3 years of local support, is there benefit in including something to marry the two up, or actually were we right in the first place? That is all grounded in being able to look firstly at what people are experiencing anyway. So we'll be having that conversation in the next few months when we next meet. I think that was everything that I could see, Jen, in both the Q&A and the chat. So if that's the case, I shall thank you, Anna, for that contribution. The evidence and that work that you just presented for ourselves is absolutely crucial in being able to say you don't have to do this intervention and wait 10 years to see what impact it has. We already know the impact, and that is just so valuable and has helped us certainly so much. So I'm going to hand over now to Mary Sinclair, who works on the Shaping Places for Wellbeing programme and is going to tell us about a more local set of briefings that we've been taking part in as part of that programme. Mary, over to you.
Thanks very much, Irene, and I really enjoyed, Anna, your presentation. So much of the different things that you've touched on and what that briefing has reflect so much of the discussion from Clydebank. So just to introduce myself, I'm Mary Sinclair. I'm the Clydebank project lead for the Shaping Places for Wellbeing programme. And I'm just going to start off, well, I'm going to start off by trying to move this slide along. 3 seconds. Next. Right, okay. So in terms of the Clydebank Project Town activity, just to give you a wee bit of context as to how the outcome briefings came about. Here's Clydebank, the area that obviously we've been focusing on. It's one of 3 towns within Western Bartonshire Local Authority, sitting north of the River Clyde. In terms of some of the early work that we did within the project was working with Public Health Scotland, the list analysts, to explore the data on the inequalities for that area. And from this, we went on to identify 5 key areas of inequality. So there are high levels of poverty, not just concentrated in 1 or 2 of the areas within Clydebank, but pretty much throughout the whole area. High levels of deprivation, high levels in terms of mental health illness, particularly for women, high levels of alcohol use, and high levels of early death, including alcohol-related. Now, we had a local steering group within each of the project towns, and what they were really keen on that we focus on for Clydebank and taking this project town activity forward was that we focus on poverty and deprivation as we were sort of progressing and carrying out the place and wellbeing assessments. Irene mentioned these earlier, and Anna mentioned about the sort of encouraging folk to carry this out on their travel plans. So we carried out 4 place and wellbeing assessment sessions in Clydebank. All of these documents that are listed here, with the first one, the Town Centre Development Framework, obviously looking to see in terms of the implementation of it, and then the other 3 documents there, when they were at their draft stage, looking very much to be able to influence that and maximise the impact that they would be able to have to contributing towards the place and wellbeing outcomes. Now, one of the things that came out very strongly in all of the assessments that we carried out was a lot of different recommendations. So within each of the place and wellbeing assessments, there's a summary of the discussion for each outcome, then there's a summary of the key evidence, and then there's a series of recommendations that are generated from the discussion, the group that's come together for that. But a lot of the recommendations had a focus around movement, particularly active travel. And really in all of our discussions around with the local organisations and local stakeholders, how people move around Clydebank and the difficulties that they experience in doing this was a recurring theme that kept coming up continually. One of the key aspects of that is the disconnect between the town centre. So if you see there the sort of at the bottom right hand side where Clyde Shopping Centre is, so that's the kind of sort of centre of the Clydebank town centre. So you can see you've got that there, but then you have a lot of the area within Clydebank is quite a distance away from it if you look at where Faithfully is, for example. The high levels of poverty really having a huge impact on people's ability to move around the area, and a lot of this linking in with a lot of the information that Anna has shared there. There's very low levels of car ownership in Clydebank and a dependence on public transport, particularly for buses. But then for those on the lowest of incomes, it was very clear through local discussions that public transport is simply not affordable for a lot of people. So it then means that straight away they're unable to access services that are within their own local community, and also employment opportunities. A lot of issues came up around the sort of connectivity between public transport and active travel and how one can enhance the other, and then a whole range of barriers to engage in active travel and to make use of public transport came up, ranging from cost to safety issues to infrastructure. So many different issues around that. And then there were also real concerns around traffic and parking, particularly around safety of this. So just to give us a very quick example of just one of the ways that it was very clear within the local area. When we were carrying out the assessment for the Clydebank Health and Care Centre, the travel plan for that, we worked with colleagues within the Western Bartonshire Council planning team who had developed a 20-minute neighbourhood mapping tool. And what this does is it allows them to look and see how much of the population or what households live within 20 minutes of key services. So this map here is showing those that are within 20-minute walking distance of the new health and care centre. So it's located in that sort of bottom right-hand corner, and so the purple line around it shows the households that are within 20-minute walking distance. So you can see for the bulk of households within Clydebank that they aren't within walking distance and that they're relying on cars or public transport or other ways to get there. And given the low car ownership levels and people on low incomes, straight away then for those who can't afford public transport, that's a real barrier to be able to access that particular service, but it could be a whole range of other services that are located around there as well. So, and then even for those who can afford to travel by public transport to that area, there were then a whole range of issues that had come up around safety, around maintenance, signage, general confidence, particularly for people with disabilities, mental health issues, and being able to walk from that distance from Chalmers Street, which is the sort of main sort of bus terminus, to the Clydebank Health and Care Centre, that 7 minutes. So a whole lot of these things were coming up. So what we looked at in terms of how we could address all of these issues and concerns, that all came up as we were producing the recommendations for each of the 4 assessment reports. And when we looked at the recommendations in quite a bit of detail and discussed that with the local steering group, it stood out that particularly around movement, they were falling within a number of different sort of recommendation types. So one of them was particularly around raising awareness of the evidence and research that sits behind the outcome. Also in terms of improving the use of data at a local level to understand the impact of this and where improvements are required, but also developing a better understanding of the community perspective and how these issues are experienced. And importantly also, and I think this comes up in relation to all the outcomes, a need for improving communication both to the general public and also between stakeholders and improving how folk work together. So in terms of our project support to progress these recommendations, it was clear that there was lots of groups and organisations and service areas that were carrying out and had different developments going on to address some of these issues, but they weren't necessarily aware of what one another were doing and what was going on. So a key part of our work was about connecting them together. And seeing that there was that eagerness to explore the issues, we initiated the start-up of an active travel discussion group, as there wasn't a group with this focus within Western Bartonshire, so that they could come together and start to feed into anything that was going on. And in considering how we would best be able to support promoting the evidence, making use of data, bringing together that with the local community perspective, we decided, along with discussion from the Clydebank steering group, was to produce a briefing on the active travel outcome. So at that stage, we very much saw the main audience for that as being those involved in decision making locally, so elected members, heads of service. But we were keen that it was going to be accessible and wide out to everybody, and it kind of had key requirements in that it was going to be engaging and accessible, clear and easy to use. You could pick up some of the content and use them in different things. It was reflective of the local area, and it could be replicated, it could be updated, or it's left as a resource that the project town could use for another area within. So we developed the active travel briefing, and as we did that, there was some discussion as to whether or not we should have the full theme, but we decided no, we would keep them separate so that it was as straightforward as possible for folk. So in terms of the format of the briefings, And I know Jen's going to include them in the link in the chat so you can have a look at them in detail. So we had very clear outline of what the outcome was, what the evidence is behind it, and that's the evidence that both Anna and Irene made reference to. Then we had the data indicators in terms of what was the data for the local area, and then we went on to what we were hearing locally from folk. So in terms of the response that we've had to the briefings, it's been pretty positive overall. Our Clydebank steering group has now requested the full set of briefings. So for all 5 themes and 13 outcomes, that will be developed. Service areas within Western Bartonshire Council, Working for You, have requested a working economy briefing, so that's something we're working on, and a whole lot of interest from within the local area and beyond. And then just in terms of how the briefings have been used, it's been a really valuable starting point for the active travel discussion group to be able to look at all the links together. Not long after we had produced the active travel briefing, Western Bartonshire Council then commissioned consultants to carry out some work to look at developing an active travel strategy. So when they saw the briefings, they then came to us looking for more detail on what was sitting behind all of that. So it was a really good opportunity to be able to influence it. Also in terms of raising awareness of the movement theme and the links to the other outcomes and the experiences of different population groups. So it wasn't just around those experiencing poverty, it was also, for example, people with mobility issues, disability, New Scots, people in recovery, a whole range of different things. And I think one of the strong bits of feedback we had was that organisations felt that they were able to raise those issues on the basis of having the briefings there. Also, the organisations making reference to citing the briefings in their funding applications, future community engagement and informing plans. And we've got one local organisation who's going to be responsible for managing a fund for local groups and organisations within Clydebank, who has let us know that they're going to be using the briefings as a way to inform the funding priorities. And I think really just to finish up, I'm very aware of the time, folks, and everybody's managing to hang on in there. Is really it has been about increasing the profile of the place and wellbeing outcomes, and also the briefings are now being developed for other project towns as well. So I think that's enough from me just now, just if there's any questions, and I'll stop sharing.
There's nothing in the Q&A section, Mary, at this point. There has been a couple of comments and questions in the meeting chat, which I think, Irene, you've managed to answer.
I've answered as many as I can. I wondered, there's a question about does the document, I think from the time that it came in, it's more to Anna, about does the document include a map across to the Scottish Government National Performance Framework to help decision makers orientate across these? I'm not aware if it does have that. Anna, can you help?
No, it doesn't actually. I'm wondering if there's anything, there's maybe other documents on the Place and Wellbeing Collaborative website already that we could make the linkages. So it's maybe just making sure that everybody's got access to all of those. Yeah, it doesn't really go into the detail of kind of the policy landscape too much, but we can help direct to where we can make those links.
And then there's another one, I think, for yourself, Anna, about is micromobility entering the conversations?
Yeah, I saw that one. I think it's a kind of new and emerging area in terms of evidence as we learn more about, you know, e-bikes, e-scooters, things like that. And the evidence is very similar in terms of the active travel. So when you look at the diagram in terms of the active travel outcomes and how that links to health and health inequalities, it will be considered within there. I think it's just something that we need to be mindful of as new technologies emerge, and how we build that into our evidence base as well.
Brilliant, thank you. I've attempted to answer other questions as best I can. Apologies in the chat itself because I could see our time was trickling away. I'm going to stop there. Any other questions, if we feel we haven't picked them up, then we've got them there on record. And as I say, the documents are up on our website to have a look at. There's an open contact there if there's anything else that people would like more detail on or support with as well. So this is really just the start of the conversation around getting more of that evidence into, as we've been saying, into decisions, into committee reports, into funding applications, and just really bringing it to life. So I hope for all coming along that it's been very helpful. It's an opener. We will be going through the other themes, but a document like this takes time, so the others will follow, and stay in touch and have a look at the website for a lot more information. Thank you very much to Anna and to Mary for your fantastic presentations and very quickly bringing to life what has been a lot of work, I know. Okay, thank you very much, everybody. Bye-bye.
Thank you.
Thank you. Bye.